Dr. E. Shen received his PhD in hearing science from Indiana University Bloomington in 2020, followed by his postdoctoral training at the Center for Hearing Research, University of California, Irvine. He returned to Bloomington as a faculty member in 2014 and moved to the University of Washington in 2020, where he's now associate professor in the Department of Speech and Hearing Sciences. Dr. Shen is a fellow of the American Speech Language Hearing Association, and research in Dr. Shen's lab focuses on developing rapid and reliable clinical diagnostic tests in audiology and technologies that enable highly individualized interventions to communication challenges experienced by older adults. And so I think you can see he has incredible expertise to share with you today on hearing in the context of dementia. Welcome, Dr. Shen.
Thanks, Bart, for the kind introduction. It's my honor to close off the winter quarter with a talk about hearing and auditory wellness and as its relationship to cognitive health for older adults. So I additionally add a little bit of information toward the end about the new updates about what's going on with audiology. The news is that we now have hearing aids available over the counter. So I'll be talking a little bit about OTC hearing aids as well. Okay, let me see. So hopefully at the end of the lecture, you'll be able to identify the association between hearing changes and cognitive decline among older adults. So here's today's agenda. So I'll be talking about the relationship between age-related hearing loss and how it's related to dementia. And then will hearing aid use benefit cognitive health? It's a big question, which we'll talk about the new and emerging evidence for that. So then we'll talk about OTC hearing aids and the candidacy for OTC hearing aids and general communication strategies with older adults. So age-related hearing loss is a highly prevalent health situation as every decade of people getting older, so the prevalence of hearing loss increases. And this is on the left here, it shows the prevalence of hearing loss, age-related hearing loss in different age groups and for male and female sex. And you can see that it's actually impact the male a little bit more or earlier, depending on how you see it. So generally speaking, for older adults over age of 70 or older, we're talking about 2/3 of individual maybe experiencing age-related hearing loss one way or another. So then this is truly a public health issue, not just can be handled by a small field of audiology or treated just as a disease. Rather, we want to think of this as a wellness model and try to make information about hearing and hearing loss available and accessible for everyone. So that's why I'm here, right? So talking about hearing to folks in other disciplines and a broader audience. If you allow me to be nerdy with audiology for a second, so this is what happens specifically with aging. So the hearing profile showing for the two sexes here, and also for a different age group. So what's showing here from the left to the right is different pitches. So from the low frequencies on the left to the high frequencies on the right. 0 in this chart is hearing capability of a typical young normal hearing individual. So lower in the chart indicate greater degree of hearing loss. As you can see, that age-related hearing loss typically start at high frequency, high pitch sounds. The consequence of that is that if we put the typical distribution of speech sounds, you can see these phonetic symbols for different phonemes And this yellow region, we typically call a speech banana. Those are the level and frequencies occupied by speech sounds. So if we have a hearing profile with the greater hearing loss at high frequencies, you can see that this threshold will cut through the spectrum of speech, and some of these sounds will not be audible anymore. So they're missing these speech sounds. So hence that impact their speech understanding. However, the question is that why so? So where does age-related hearing loss come from? Typically speaking, there are two kinds of age-related hearing loss. One we call sensory loss, that is in our inner ear, the cochlea. There are these very intricate hair cells, sensory cells. So these cells have hairs on top of them, so that's why they're called hair cells. They sense the acoustic information come in from the outer and middle ear, and then convert that into the signal that the brain will understand. So they're the critical step. They are also the most vulnerable part of the whole auditory pathway. So over time, we'll gradually seeing the loss of the hair cells. So that contribute to the sensory aspect of age-related hearing loss. So that's also more severe towards high frequencies. If you see the red, let me try to make a pointer out of here. Pointer visible. I'm not sure.
We do see the pointer.
You do? Okay.
Yeah.
Well, the red curve here is the profile for sensory type of age-related hearing loss. And there's also a subtype of age-related hearing loss is due to metabolical reasons, because the way the cochlea runs on a battery that require a potential difference between different subcompartments of the cochlea. And with aging, so that battery is gradually losing its voltage, so to speak. So that will make more of a uniform impact on hearing across frequencies. So those are the reason why. However, one thing to point out is that these changes in the auditory system and its consequence in terms of impact in speech understanding is only one aspect of the impact. So the impact of age-related hearing loss is not limited to these auditory or hearing consequences. So according to these World Health Organizations, I see classification. So if we want to think about this missing of speech sounds or missing sounds, those are just body functions and structures. Consider the full impact of hearing loss, we really need to think broader. So in terms of the limitation of hearing loss put onto older adults in terms of the kind of activity they can participate and the employment or learning activities they can participate. So that really limit a person's everyday life. So hence, there's no surprise that age-related hearing loss is related to higher risk of social isolation, depression, dementia, which we will talk more, and risk for falling and inability to participate social, physical activities. So in terms of dementia, let me just find this. In terms of dementia, evidence have shown that among all the modifiable risk factors for dementia, which is plotted in this info chart here, so there's risk unknown for about 60%, but the modifiable factors are about 40%. Among those 40%, hearing loss not early, like in midlife, we're talking about 40 to 65 years period. If you have hearing loss during that period and left untreated, so that will lead to about 88% of dementia risks. That converted to 800,000 of the nearly 10 million new cases of dementia diagnosed every year. So this data is coming from the States. So and since then, because people have been thinking, oh, maybe this data is just a particular population in the United States, this has been replicated in pretty much every single continent. So I'm showing data from these various studies for Australia, for Latin America, India, and China. So hearing loss in midlife covers about between 6 to 8% of contribution to dementia. So this is pretty solid evidence that these two things have association. However, one thing I have to point out is that comorbidity or correlation does not mean causality. It doesn't mean that hearing loss causes dementia. They just sharing these comorbidity, sharing this. There's a lot of people who have both co-occurring. So it's hard to say that hearing loss is the worst predictors of dementia. As a matter of fact, I think among all these risk factors, the one thing that one can have full control of that is really bad for mental health is still smoking. So smoking is bad for mental health. That is also showing up repeatedly, as you can see in these charts, increase the risk for dementia. So now that we established the hearing loss in midlife is associated with dementia risk, then the next question is that if we put hearing technology or amplification to older adults, will that help? Will that help? So wearing hearing aids or other assisted hearing technology, would those devices help with cognitive health? So because this is an important topic, so there's a recent effort to run randomized clinical trials on this. In particular, this one ACHIEVE study led by folks at Johns Hopkins. They recruited sizable older adults and have people divided into intervention group and control group and do this 3-year follow-up to see whether there's any changes in cognition after use of hearing aids. So here's what they found from this ACHIEVE study. So they have 2 cohort of older adults in the study. So one cohort is recruited from an ongoing longitudinal study of cardiovascular health. So they just recruited into this hearing aid study. And then they separately recruited new volunteers as well. So it turns out that this group that has been enrolled in this cardiovascular health study who are more likely to be smokers and have other risk factors, where we call it high-risk group, they actually showed the significant benefit for general cognition after 3 years of hearing aid use. The other group, the healthy volunteers, typical aging adult, they did not find significant benefit for hearing aid use. So that's this ACHIEVE study. There are more studies like this trying to see whether there's any evidence that hearing aid use will benefit cognitive health. So here's a summary of a couple of studies in a recent meta-analysis of past year. So in this case, the grand overall summary is that hearing aid use does reduce risk for dementia. And of course, this evidence is still emerging, so we don't have as many studies, but there's at least some study with a pretty large sample size, as indicated here. The sample size is in this column here. So there's emerging evidence to support for the use of hearing aid and the fact that hearing aid may benefit cognitive health, especially for those who are already more at risk for dementia. So this is, I guess, the take-home message of this talk, if you will. So now that let's switch gear as to now that we know it's beneficial to use hearing aid for older adults, how to get hearing aids to them. So that is another issue that we're better with. The fact that among all older adults that could benefit from hearing aid use, only a small fraction of them actually uses one. Additionally, if for someone who considers hearing aids, so basically from the diagnosis of their hearing loss to the actual purchasing of the first hearing aid, on average, there's like 7 years of wait. And the question is why? What's underlying this low uptake of hearing aids? So that baffles the field for the long time. So here's some survey indicating the typical reasons that people say that why they're not considering or seeking professional help in hearing. General theme are two. Affordability and accessibility. So this is the distribution of where are all the audiologists in the United States. So as you can see, there's a big chunk of land area are not covered by any audiological service at all. So the accessibility to audiological services are not so great as compared to the distribution of pharmacists. So we are a very small field. We don't have nearly enough workforce to service a big health problem, like what I said. So accessibility is not good. Affordability is another issue here. The hearing aids or prescription hearing aids, as you now called, they are quite expensive. A typical pair of hearing aids could cost, $5,000, and sometimes out of pocket. So I've heard people saying that for a lot of older adults, the largest out of pocket item they paid for is their car. The second is their hearing aids. So that is not really helpful for making these devices accessible and available. Because of this confirmed association between hearing loss and dementia and cognitive health in general, the Congress or the president and the Congress have decided, oh, there must have be ways to address this. So they formed back in 2009. So they formed a working group on increasing the accessibility and affordability of hearing healthcare. And then the report come out of the study is become available in 2015 and 16. There's these two reports. And these reports have both recommended a new category of hearing aids that would be more available to people. So hence they tasked FDA in 2017 to create a new category of hearing aids called that can be sold over the counter. So OTC Hearing Aid Act is a bipartisan act by the Congress. Basically, they task force the FDA to create this regulation associated with OTC hearing aids. And you may ask, why don't they just open up the market and have hearing aid so freely without regulation? Why FDA has to involve? Because it's actually really easy to build a device that looks like hearing aid and does not work, and could harm hearing and cognitive health. So hence, FDA has to be involved to ensure the safety and effectiveness of hearing aids. So that's why. It takes a little while of generating the first draft of policies and gathering feedback from the field, and then the final ruling come out 2022. So that's when the first OTC hearing aid began to be available on the market. I think it's December 2022. So with this new devices, now that formerly known as hearing aids, now is called prescription hearing aids. And then there's this prescription hearing aids, and then there are these OTC hearing aids. Over-the-counter hearing aids also have these two subcategories. One is kind of works straight out of the box, and there's presets in them. People can cycle through and find the preset that work well for them, or they can be called self-fitting OTC hearing aids that these devices usually connect to a cell phone. Then the user has to go through some kind of hearing test or adjustment to get the device fitted to their needs. But there are other devices that are hearing aid or hearing related. They are not hearing aids. So for example, some hearables and assistive hearing devices or personal amplification devices are not hearing aids. Basically, if they do not have the word hearing aid on the box, if there's no label approved by the FDA on the box, then this is not a hearing aid. So this is the availability of OTC hearing aid really helped making these devices accessible. However, it also created a new problem. That is, there's all kind of different subcategories of devices. A regular older adult, a lay person, may not know the subtleties, right? So this points to the educational needs. So now looking at the hearing aids, OTC hearing aids on market, so they're between $200 and $2,000 a pair, depending on the technology involved in them. So here's just some examples. Last year, AirPods just gotten FDA approval to be hearing aids. So basically, if you have the new AirPods, there's already a built-in function in the iOS system that can have these AirPods fitted and function as hearing aids. So that's what's on the market now. So how do we know our patients or our clients are good candidates for OTC hearing aids? So the candidacy requirement for these devices they're only for adults. So no pediatric usage for OTC hearing aids. And they're for older adults with perceived mild to moderate hearing loss. You may wonder, oh, what's with the word perceived? Why not just say this is for adult with the mild to moderate hearing loss? That is because mild to moderate hearing loss is tied to a diagnosis that can be made only by an audiologist. So the OTC hearing aid, the goal is to make these devices accessible without the need of a formal diagnosis from a licensed professional. So hence the word perceived mild to moderate hearing loss. And the problem then is that how do we know a client, an older adult, have perceived mild to moderate hearing loss? Actually, there are already very well-established tools, self-screener, 10 questions, and easy scoring that can tell whether someone may be a good candidate for OTC hearing aids. So this particular tool I'm showing on the screen is called HHIE. It's a screener version, hence the -S, so the short version of the screening tool. So basically, for each of these real life listening situations, they indicate how often they have this issue or difficulty, and then we sum up the score, and then we can have this rule of thumb as to if this is someone that scored between 10 and 25, that suggests that this person may be a good candidate for OTC hearing aids. So this is called HHIES. It's freely available. If you just Google this, you'll get a PDF of this from the internet quite easily. So the availability of OTC hearing aids and these more accessible screening tests also kind of allow us to pick out who may not be good for OTC hearing aids. And these are the situation we maybe is an opportunity for general referral for audiological or ENT services. So for example, we know that they are not for children, and they're not for people with more than moderate degree of hearing loss, severe hearing loss, or profound hearing loss. Not for asymmetric hearing loss. Usually people with asymmetric hearing loss, meaning hearing loss is greater in one ear than the other, require attention from an ENT doctor. And tinnitus is not what the OTC hearing aids are designed for. So these things are what OTC hearing aids are not designed for. So usually the FDA requires OTC hearing aids to have this labeling on them to point out that who may not be a candidate for OTC hearing aids and all the red flag conditions that someone may consider to see a doctor or hearing healthcare professional. So these are some of the red flag conditions: drainage, sudden hearing loss, dizziness, pain. So we also have a screening tool on the internet. So someone from our field developed for people to self-test whether they need to see a medical professional rather than getting the OTC hearing aid. This is off of the Northwestern University. So if you want to learn more about OTC hearing aids, there's many great resources on the internet. So here are some associations or organizations. They are not funded by manufacturers, so they're kind of unbiased. Hearing Tracker is an online community of hearing technology users. So they have a forum for people to interchange and exchange their experiences. They post a review of the most up-to-date reviews of the devices on the market. And Hearing Loss Association of America is also a association of individuals with hearing loss. They also have these information on their website as well. So last but not least, I'd like to talk a little bit about communication strategy. So we work with older adults, and we know a majority of them may experiencing some degree of hearing loss, age-related hearing loss. Then what is the most effective way to communicate with them? So some tips here, maybe that's intuitive, but here are some of the tips. Always face the listener, right? So making sure that your client can see your face and lips. So that helps them understand your speech a lot. And that happens even without them aware that they've been reading lips. So we have older adults coming to our lab, and I ask them whether they read lips. They swear that they don't read lips. But if as soon as I cover my mouth, and they realize, oh, they start missing half the words. So seeing the talker's face is very important for many of them. Um, so speak clearly is important. Uh, Often, uh, when we have trouble with communication, we unintentionally raise our voice, right? We speak louder and faster. Neither of this help communicate more effectively. Rather, we want to pronounce words clearly and slow down. Slowing down actually helps more than raising the voice. Uh, and of course, the last point is probably don't need to say, we don't want the food in our mouths while we're talking. So other things that may be helpful or we may already have in our phone that you may not be aware of. So for both Apple and Android phone, there are free live caption services or functions that you can switch on. So for example, I'm a Google user, so I have my um, live transcription app on speed dial, so I could go to an event with older adults and just holding this phone by my face, so it will show up with live transcription of my voice. Apple has this feature under accessibility and then live captions. So that could be switched on quite easily. So these captions provide additional help to ensure your clients or older adults you are communicating with can understand you. So that is communication. So in summary, so today we've talked about hearing loss is a highly prevalent public health issue, and leaving hearing loss untreated may put the individual at risk of cognitive health. We have emerging evidence to support the use of hearing aids to promote cognitive health among older adults. So with that, so we have more, we have effort from our field to make these hearing aids available by making them available over the counter. So creating this new category of OTC hearing aids. So there are resources about candidacy of OTC hearing aids, new products, reviews on the internet. Now become available. However, one thing I think is still falls short is the educational piece or the support, right? So there's a lot of devices available. If you go online on Amazon or Best Buy, there's many devices with large range of price point. So how to make the end user feel confident about their decision of purchasing these devices or about the potential benefit from these devices. This is still a topic that our field is working on. And this is not just us because we are a small field. So I feel like this is an interprofessional effort. So that's why I'm here and trying to hopefully get our colleagues in our discipline, other disciplines on board in delivering these knowledge or information to broader audiences. Okay, so that's all I have for today. I went by a little faster, but hopefully that will give us time for some discussion. Very curious about your thoughts on this topic.
Thank you so much. We do have a couple of comments and questions Lisa mentions that the inexpensive hearing aids, and I'm assuming she's talking about the OTC ones, only cover certain pitches. And you had mentioned there's a way to tell whether you should see an audiologist or purchase something like that. Do you have any information about that?
Yeah, so that is a great question. So the regulation, that's hence the importance of FDA regulation. Per FDA regulation, OTC hearing aid need to have the same electroacoustic capability of actual prescription hearing aids, meaning that they should be as good in terms of their capability as prescription hearing aids. The difference is that there's a limitation of a maximum output, so people won't accidentally damage their own hearing. So they are as capable to providing these high frequency sounds as prescription hearing aids. However, the device need to say on the box, OTC hearing aid, literally OTC hearing aids. If you have a hearing aid-like device, the packaging has other things. It does not say hearing aids, does not say OTC. Those are the devices not regulated by FDA, and the performance of those devices are usually questionable. As a matter of fact, there was a survey of these devices called personal amplification devices in the market, and more than half of them actually reduce speech understanding rather than improve. So that is really questionable. Yeah. So the key thing is they need to be labeled as OTC hearing aids.
Interesting. So Richard asks, how harmful is forgetting to wear your hearing aids?
How harmful?
Uh huh.
So hearing aids are designed to be helpful, and people are actually very, very strict about whether they would actually cause further damage of hearing. So hence, these OTC devices are limited in terms of how much the maximum sound they can put out. So to make sure that they will never cause further hearing damage themselves. For prescription hearing aids, they are more capable, pull out more sounds. So they could put out sound to the range that could potentially cause hearing damage. But those devices are fitted by licensed professionals. They know to what degree that they can put out sound, and they tweak the device to be safe and effective for their clients. So in a way, the safeguard for prescription hearing aids are the trained professionals, and the safeguard for OTC hearing aids are the FDA regulation.
Okay, that's helpful. Thank you. Also wondering about the AirPods. Someone mentioned that there's a hearing test feature of the AirPods. Do you have any sense of how valid the results are?
It is as valid as that is a hearing test that is out there. So the Apple hearing test there's a lot of research behind this particular hearing test. Um, and I personally know people that develop the hearing test because I develop hearing tests myself. So that hearing test is very good. So it also has this additional feature that monitor the ambient noise because hearing tests require someone to be situated in a quiet environment. So the microphone on the AirPods monitors the environment to ensure that the test is done in the correct environment. Also, Apple are very good in terms of delivering sound accurately into the ear. So the hearing test result is as valid, actually, I would say, as what you get from the audiology clinic. The hearing tests will directly be used to fit hearing aids. So once you've done the Apple hearing test, then you can just implement that into your AirPods to have it function as hearing aids. So that is a stream seamless process for AirPods. Yeah.
Interesting. So Mary says, do you know of programs that are available for someone's iPhone that will type the conversation and then the hard of hearing person can read that on the phone screen and respond? She said her aunt has this, but she doesn't know what it's called. It sounds like something similar to what you were talking about.
Yeah. So to start off, the ADA law require to make these communication available for people with disabilities, including people with hearing loss. So for older adults who has hearing loss, they're qualified to get free caption phone service. So if they want to have a landline phone with caption on them, so that's a free service offered by many service providers. So the same service provider also built apps that turn voice into words, and then that show in front of older adults. So some of these services are free of charge. Some of the services are provided at a very minimum fee. So these services are available as well. Generally speaking, if you have a phone that can recognize your voice, then you can just put up a notebook app and then just speak to it. And then the words will show up on the screen. So that could act as a note exchanging or note taking device right away.
So Ray is also asking about the app. She said, as a staff nurse, she carries an iPhone. Could you say more about the iOS app, that it could be helpful in engaging with patients while masked in the inpatient settings? Would prompt use of the hearing aid, not waiting 7 years to help stabilize or prevent hearing loss?
Yeah. So basically, we want these older adults to maintain if efficient communication, or whether they get hearing aid right away or not. So there's already ways. Maybe they already have an iPhone that is available, or AirPods that's available, right? So for the live caption, that's under accessibility. So if they go to settings, accessibility, there's a live captions function. If they just switch on, there's then you can pick how you want the caption to look, size, font size, because older adults also have challenge in seeing, so that you can change how it look on the screen. So that's a live caption. So for the AirPods as hearing aids, so for the new AirPods, I think if you have had a pair of AirPods for a while, then you may need to go through a firmware update. But the new AirPods, they're straight out of box, ready to act as hearing aids. You just need to download the Apple Hearing Test app and then go through the hearing test, and then that will can set AirPods to hearing aids. So basically, there's a AirPod manual under the settings, so that will you can switch it on, and that will act as a hearing aid. So one thing I want to also point out is that hearing aids do not only amplify sound, so it does amplify sound, make sound more audible, but newer technology also have a lot of noise reduction features to them. So that really help in noisy environment. Like AirPods has pretty good noise reduction algorithm in them.
So
Um,
oh,
mhm.
Lisa mentioned she had a fairly deaf individual in her office using a device. She didn't tell me she was using an app on her cell phone to communicate. She was that good at reading and responding. Um, she said she doesn't work with dementia so much, but it was wonderful after she figured out what was going on. At first, she thought she was ignoring me. That kind of brings up a question for me about how, what has been your experience in sort of implementing some of these iPhone apps when trying to communicate with people with dementia who are hard of hearing?
That is a great question. So my collaborator, Dana, who did the dissertation on OTC hearing aid use among older adults with dementia. So basically, the original goal is to make these devices more accessible, including for older adults with dementia. But however, the study shows that if you put a box of a product in front of them saying that here's the manual and here do it yourself, and it actually not, as you can imagine, it does not work quite well. So there's a lot of support that's needed that is not included in the box. So for many manufacturers, these manufacturers provide support in variety of ways. So in a way, so the delivery model is not settled yet for OTC hearing aids. Ranging from some manufacturers just treat this as typical tech support for any consumer electronics, just a call center, versus the whole fully licensed audiologist on call for users to meet with users, right? So there's a range of services provided, and that also built into the price tag as well. Uh, uh, so yeah, so for the dementia piece, there's a couple of things that we now know. One thing is that so the instruction and all the self-fitting process that come with these OTC hearing aids may be too challenging for some of these adults, older adults with dementia. Second is there's also a dexterity issue, the motor skill issue. So these devices are small to handle. So without someone's help, it could happen that they could misplace or not being able to fit the hearing aid on themselves. We actually just went to a nursing facility in Issaquah about a month ago, and this with the specialized dementia care. So some of these individuals there are in their 90s. So we've seen older adults wearing hearing aids. They paid a lot of money for the hearing aids hanging out in the air. It's not in their ear. And they were complaining about it's not working. So yeah, so that is a real concern.
Well, yeah, and I was thinking maybe for everyone, but particularly in terms of folks experiencing dementia, um, keeping track of the hearing aids and not losing them or dropping them or whatever could be
Yeah.
an issue.
Yeah, so that's why. So I hopefully a reoccurring theme I'm trying to point out is that there's a need or unmet need to provide support, and this support may not should not maybe is not the right target audience to target this education or support to the older adult with dementia themselves, but rather their caregivers or professionals who work with them closely so that they are more confident to provide assistance or guidance to help them navigate uh, the use of technology, for example.
A really important point. And I'm actually going to pose one of those questions that asks about interprofessional considerations for those of you across disciplines in different settings. To what extent do you already have in place um, um, equipment, technology, procedures to support these kinds of apps or features when you're working with older adults? Feel free to chime in if like you have something in your setting that you're able to pull out, or I'm thinking the AAAs, when you go do case management in the homes, do you have equipment that you can bring if there are issues of hearing loss to at least facilitate the communication? And maybe while they're thinking about that, I'll pose another question from Ivan, who asks about, do prescription hearing aids help treat tinnitus?
Um, uh, so tinnitus is so management of tinnitus is a complex topic. Hearing aids sometimes are used for treating tinnitus for sure, especially if for someone with hearing loss and tinnitus. Hearing aids are being used. The idea is that providing some moderate amplification will help the brain adapt um, and then to be less sensitive to tinnitus because tinnitus now, that as we understand it, is the brain's response to the degraded peripheral sensory input. So when you start to have hearing loss, the brain is receiving less, so they turn up the volume, uh, sometimes amplify the spontaneous activities and interpret that as hearing. So so providing more a moderate amount of sensory input by using either hearing aids or sometimes they have these program where ask people to listen to moderate level white noise or pink noise that help regulate the central gain provided by the brain. So that help with tinnitus. So that's at least one approach.
Okay, and Vanessa, I didn't get a sense of her setting, but she said that they do have pocket talkers to amplify
Mhm.
sound, which I do think are sometimes available in settings. And Lisa Baxter mentioned that she works for a AAA, that she currently has no app on her cell phone, but she can ask a client or confident that she'll be able to communicate, very willing to communicate in the style they need. But dementia always poses a risk
Yeah.
with communication.
Yeah. So I'd say communication strategy is as important as technology. Technology is, making sound audible, but then, you still need to slow down, use shorter sentences and these facing the person, for example. So the pocket talker or any of the amplification devices are great to help your voice being heard. That typically work well for a quiet environment in a one-on-one situation. So if you are working in a scenario that you are facing a group, in a group setting is challenging, very challenging. Um, so you have to appreciate that even just having a group of individual talking at a table, older adult with dementia is already could be challenging or overwhelming for them. And sometimes they complain, oh, people are being too noisy or too loud when in a group setting. But we don't hear it being too noisy. But I think that's their reaction being saying that all these auditory input is overwhelming.
Mm.
Uh, so sometimes amplification could overwhelm them. Yeah.
So Mary and Mary is a primary care provider. She said she's used a disposable or regular stethoscope with the patient wearing them while she talks into the bell. That's something we used to rely on years and years and years ago. But thoughts about that, Dr. Shen?
I actually have no experience myself with this approach. Just given that, we have uh, you know, so we have kind of focused on technology now.
Yeah.
Uh, uh, but I think if it works, and if it helps, then keep doing that. I think so. That's actually this. I feel like I learned something.
Well, and Diane mentions that's old school, but I think Mary and I both have had experience doing that, and it's at least available in
Uh-huh.
many, many settings when you're interacting with an
Uh-huh.
older person
Uh-huh.
and don't have a lot of that technology. So,
Yeah, but I have to say that so these devices, when you do talk into the bell, the voice are somewhat muffled. It's amplified, but somewhat muffled. There's a risk of missing high frequency cues. So
And
it's
that would have
not like
impact discrimination too, right?
uh-huh.
Yeah.
Yeah, so exactly. So they're not ideal. It amplifies sound. So sometimes maybe audibility is not the issue, but clarity is the issue. So when that is the case, then I'd rather try to have a live caption app in front of them, have them read through what I said.
Hmm. I used to train interviewers across the country, and often um, they were often sort of young students who were taking on these positions to interview for a research study, and um, we would talk to them about it doesn't help as much to talk louder because it
Hmm.
takes your voice up higher
Yeah,
pitch, and
yeah,
these young students, it just wouldn't be easy for the
yeah.
research participants to hear this was a study of older women.
Yeah, so I think, there's a couple of things we can do, right? One is that we take care of our environment. So when you sit down with the older adults in front of you, make sure that environment is not noisy. So there's not a lot of going on. There's not like also less distraction, right? So if you could be in a quiet place, but there's like people walking outside of the door and you can see them. So that is also distracting. So all of those things could impact communication. And then in terms of the talker, as I was saying, slow down usually helps.
Mm-hmm.
We actually research show that speech understanding could improve a lot if you just slow down. Um, and they just need more time to process. They're not like necessarily hear less or understand less. Yeah.
Mm-hmm. Yeah, and particularly for people who are repeating the same thing over and over and over to customers or clients
Uh-huh.
or whatever, it's kind of hard sometimes for them to remember, and it's important to remind them to slow down.
Yeah, yeah. So so when you are working with young people, it takes some skill or experience to have the kind of patience, and to develop these kind of soft skills to work
Yeah,
with an older adult with dementia.
yeah,
So that is definitely something that maybe being upfront to these students. Um, so they should expect some kind of frustration, but they need to slow down, monitor themselves. So that may help.
well, this has just been excellent. It looks like we don't have a lot of other questions. Lisa mentioned that she really loved this topic. It was so important. So I just want to say thank you so much. As many of you know, we were going to have an additional focus on uh, issues of vision, and our speaker is in flight right at the moment on an emergency. So I want to thank Dr. Shen also for agreeing to fill the full time for his talk. It is an important topic, and I've learned quite a bit about available technology and apps at this point. I'm glad I have an iPhone.
Yeah. Also, that if I just try to be useful for the last 1 minute, one
Mm-hmm.
thing I want to point out that is that almost all the hearing aid has a free trial period. All the prescription hearing aids are regulated by the law. They have to have a free trial period. The OTC hearing aid also follow suit, so they typically have 30 to 40-day free trial periods. I just want to throw it out there. I feel like this is important information.
I appreciate you mentioning how long the free trial period is because that's important as well.
Mhm.
All right, everyone, I want to thank you for attending the series. I have posted in the chat how to connect to the attendance log as well as how to register for the general geriatric series that starts up in a couple of weeks. And look forward to seeing you then and have a really nice spring break. And Dr. Shen, again, thank you so very much.
Thank you very much for having me. Bye.
Bye-bye.